one level, the programme for government, had everything in it. It was motherhood and apple pie. But some of us were critical that when you actually looked at the detail, it was vague and aspirational and didn't make tangible commitments in the key areas where people demanded change in the election. So it's really on that my question is focused. I mean, if you take the age-friendly Ireland section, sounds great, at an age-friendly Ireland section. It's aspirational, broadly nice, but totally aspirational. And then you look at what's actually happening. We had a disaster in the nursing homes in the context of COVID-19. Huge number of infections and fatalities because our nursing home care in this country is completely dysfunctional. Completely dysfunctional. HICWA's report finds more than 50% of nursing homes were below standard in the report. You look at the situation in Merrion Road, and I particularly want to just shout out for the families and workers in two nursing homes on the Merrion Road on land owned or directly owned by the Sisters of Charity, both closing down at the moment, right? Because a religious organisation essentially, it would appear, decides the land on Merrion Road is very valuable to them. They probably want to flog it to developers. So they just unilaterally shut down the Caritas, end the lease for the Caritas nursing home and shut down St Mary's, leaving the elderly and the families of those people in there high and dry, and the workers high and dry. Now this, by the way, is in nursing homes where there wasn't COVID cases. So these were the good ones, but it's indicative of the dysfunctionality of the area, because the Sisters of Charity are deciding the future, in this case, the end of nursing home care provision. And what are we doing about it? What are you doing about it? What tangibly are we going to do in the aftermath of COVID to make sure we are in charge of ensuring that we have the capacity in nursing home care that we need, that we are genuinely in control of it, that it has the resources that it needs, that the workers and the residents of nursing homes are properly protected? And maybe specifically, what is your government going to do about the scandal that's unfolding on Merrion Road? That's just one instance. One could say the same thing about the urgency in which people in fact, the specific way in which the programme said it would protect tenants during COVID-19, and now it's absolutely unclear, are many tenants going to be evicted on the 1st of August when the temporary ban ends? So where's the tangible action on the things people asked for?
Deputy Boyd Barrett's point in terms of, there's two dimensions. Look, our system has evolved. You mentioned yourself that those particular nursing homes were COVID-free, so we need to put on the record that quite a lot of nursing homes in Ireland did well in preventing COVID from spreading within their particular homes. But I do take your point that in terms of the initial response, all the emphasis was on the acute services for understandable reasons in terms of protecting ICU and so on. There was a very significant spread of the virus within nursing homes, which caused loss of life. And now that has happened in other societies. The elderly are particularly vulnerable to COVID-19. There's been a lot of support since, though, to be fair, over the last number of months, put behind nursing homes in terms of PPE, in terms of engagement with the HSE and clinical oversight, and that's important. The testing has been really systemic now, and the HSE have organised serially now to do testing of nursing homes and staff in nursing homes on a regular systemic basis, which is important. I would favour the development of home-based care as a potential. You will always have a need for nursing home care, but we need to significantly resource home-based care as well, and to enable people to avail a fair deal in the context of home-based care. And I'll follow up and see what the exact situation and come back to you on St Mary's and Caritas.
Deputy Boyd Barrett.
Yeah, I think my point, Taoiseach, that arises from the experience of what happened with COVID-19 in the nursing home sector and with the Caritas St Mary's situation is that we have a completely fragmented nursing home care sector. Some of it's good, some of it's not so good, but we're in control of hardly any of it. So the nuns, in this case, who seem to have turned into property magnates, from what I can see, I mean, they seem to have lost any interest in the workers that worked for them or the residents in the nursing homes. They just decide we're closing it down because this is valuable land and we can flog it. And it's allowed. I mean, this is part of, or should be part, of a National Health Service. Cradle to the grave National Health Service. And yet its fate is decided by the Sisters of Charity, who've just become big business and see property value as more important than nursing home care, which is what was being delivered, and good standard nursing home care, but the workers are just gone, and the residents and their families are left high and dry. That is not acceptable, and we need intervention, and the state should just take that land and make sure that those jobs, those nursing home places are protected. And I think that is the lesson more broadly of the COVID crisis. I mean, Paul Reid said it at some of the briefings you were at. When we asked him what's happening in the nursing homes, he more or less said, I don't know, because we only control 20% of them.
Thank you.
That's the problem. They need to be part of a National Health Service so we know what's going on, and we have the power to step in and ensure consistency and standards, proper resourcing and oversight.
In terms of Deputy Boyd Barrett, many state-owned healthcare centres had huge challenges as well in terms of COVID-19. Some worse than nursing homes in the private sector. That has to be said, you know. And some of the significant clusters happened in some elderly care settings within the state system itself. And I agree with you that it is wrong to sell and to close down those nursing homes. But the state, as of now, doesn't have either the constitutional or legal framework to stop people dealing or doing, making decisions of that kind. You know that, but yet you will say we should go in and stop it. You know, it's just not. That's easier said than obviously done. But I think what we have to do is change the model of caring for our elderly. That's what the programme for government is committed to, both in terms of home-based, community-based interventions, as well as there will always be a need for long-term nursing home care as well.
Thank you, Taoiseach. That concludes